We are joined today by Catherine Teare of the California Healthcare Foundation. Catherine, welcome.
Thank you.
As we know, your organization for the last few weeks has been, along with the Ipsos survey firm, conducting a series of surveys here in California to measure COVID-19's impact on the state, the impact on access to care, the impact on mental health, the access on questions about affordability, and much more. So I want to go over some of those findings with you here in just a moment. But let me start, Catherine, by asking, what's the utility here? What was the thinking behind launching this series of surveys?
You know, one of the things that the foundation thought that we could do to be helpful to the state in this crisis was to get out early and to track both the experience of Californians and their opinions as we move through this intense stage of the pandemic. So we've been able to ask questions about people's experience in seeking care and receiving care, their experience with seeking testing in particular, and then of particular interest, I think, for us today, their experience with mental health issues, stress, kind of stress they're feeling, whether they've been able to seek care, et cetera. We know that we're seeing increases, for instance, in the use of telehealth, and that's something that we think is important to track as we move through.
Yeah, and no question that there'd be this impact on mental health. These are stressful times. People are facing anxiety, and so many people now are finding themselves in an unusual lifestyle where they're isolated, that they need to be isolated because of this whole need to flatten the curve. But it's a different dynamic where people are working from home, not able to get out as much, maybe hanging out with family that they're not used to hanging out with, those kinds of things.
Yeah, and I think, you know, another piece to that I think many people are experiencing is having children at home and out of school and needing to do the teaching along with working in some cases, or in other cases, being out of work, which is, of course, its own very serious stressor.
That's right, and that's a great point. With the schools out, parents find themselves having to embrace and figure out virtual classrooms and distance learning. So that's one more bit of challenge on top of everything else. What does the survey tell us right now about testing? We know that obviously there's been some restriction on the amount of testing that's available here in California, but what are people telling you in the survey about their access to testing?
Yeah, we're still seeing, not surprisingly, very small numbers. So about 3 times as many Californians report they've been tested for the new coronavirus this week compared to the previous weeks in which we asked this question. It's up to 2.3% this week of people who say they've been tested. So that's still very small. There's a greater number of people saying that they think they do need testing right now. Again, small numbers, now 35% or so, up from 32% in previous weeks. A small number of people say that they've been unable to get tests. That's 1.5%. And again, that's slightly bigger, it's still a small number, but bigger than in past weeks.
And as you point out, the state has been saying that really you should only be tested if you are experiencing the symptoms, not if you simply suspect you have it. So these low numbers are expected, right?
That's right. That's right. I mean, testing has been discouraged, as you know, except for people who are healthcare workers or experiencing symptoms or known to be a close contact. So we wouldn't expect to see big numbers. They're inching up, however.
Yeah. One of the other items that the survey is meant to survey is access to healthcare itself. And in-person visits of physicians to physicians, other healthcare providers have been dropping off since you started the polling back in March. But what are the current numbers as measured by the survey?
Most recently, in this week's survey, and again, this is the 3rd week that we have asked this question, 71% of people said that they haven't tried to get health care in the last 7 days. So again, people are not, are mostly staying home from healthcare. Small numbers of people have said that they tried to make appointments but couldn't get one, or that they've made appointments but had to wait a long time. Those hover in the 2% range across all of the respondents. And again, our survey is statewide and about 1,100 people. So it's representative. We see about 4% of people overall saying that they've successfully seen a provider in person in the last week, and 6%, and this is an increase, saying that they've successfully seen a provider either by phone or video. And I think those really are very interesting numbers to see how that use of telehealth is inching up. Again, it's up, still small, but up from 4% to 6% over the last week.
Yeah, I was going to ask you about the telehealth aspect of that, because that's something we, again, would expect. And I think it's probably going to some degree, change the way healthcare is accessed in the future once we get through this period, right?
Well, I think we don't know. And I think it's a really interesting, really a natural experiment to see how both providers and more importantly, consumers can adjust to this, where they find that it's useful and it works well and where it doesn't. Anecdotally, I was just talking to a friend who is pregnant and has seen most of her forthcoming prenatal visits moved to virtual platforms and is doing her own blood pressure testing, for instance. And so far that's great. But you know, we know that people will have different experiences with those new technologies. And for our part at the foundation, we're particularly interested in tracking how those technologies work or where they don't work for people who may not be English speakers, for people who may not have good broadband access, for people who live in situations where they may not have the privacy necessary to conduct a visit, and of course for seniors who may, as a group, may be less comfortable using those technologies.
That's right, not something they grew up with. You mentioned earlier that one of the particular areas you were interested in was measuring the state of mental health here in California. And obviously, as we talked about, these are unusual times. There is a certain amount of anxiety out there. But what's the survey specifically saying?
So in the survey, we asked specifically how people feel their mental health is in this time of crisis. And let me look up the exact wording. In the last 7 days, how has your mental health changed, if at all? And the options are from improving, a lot or a little, getting worse, a lot or a little. Most people say, as they did last week when we asked the same question, that their mental health is about the same. So that's about 2/3 of the population. We do see, though, an inching up of people who feel like their mental health has gotten worse in the last week. It's about 27% overall. And we broke that out also by people with low incomes, under about 138% of the federal poverty level. So that's people who more or less are eligible for Medi-Cal. And we see about the same numbers there. And that's a little more than we saw last week. That's not surprising. The big discrepancy, I think is of interest, is that we see about double the number of women saying that their mental health has gotten worse in the last week compared to men. So about 36% of women, half that many men.
What about ethnicity?
There's some difference, but I think not a lot. I think the numbers are slightly higher. The percentage, I believe, is slightly higher for Latinos responding to this survey. Let me just look at those. Yeah, slightly higher for Latinos than for Black or Asian American Californians. But I don't know how substantial those differences are.
Okay. One of the things that you're also looking at is this whole question of affordability. And I know there have been concerns been expressed by people about their health insurance, whether they'll still have health insurance, but overall, can they afford to get treatment if in fact they do contract the virus? And so what's the survey saying about that?
Well, not surprisingly, people are worried about affording treatment should they develop COVID-19. About 1 in 3 people overall say that they are very or somewhat worried about the treatment costs should they develop COVID-19. Among low-income Californians, it's nearly 1/2.
Pretty substantial, yeah.
Yeah, and not surprising.
Yeah. So that's kind of a quick overview of the survey's findings, but as you look back on it, and in particular when it comes to the issue of behavioral health, what really stands out for you here as most significant, would you say?
Yeah, and this is some from the survey and some from other work we've been doing and conversations we've been having. I think as the crisis continues to develop, stay-at-home orders continue, as we expect they will for some time, it's reasonable to expect that people's stress, from all the reasons we've talked about, lack of employment, kids at home, lack of opportunity to be outside, that stress is going to continue to grow. And I know that healthcare providers, mental health providers in particular, anticipate their own form of surge. You know, we talked a lot about surge in the hospital setting. I think it's fair to expect that we will see a surge of people needing a whole range of mental health and substance use disorder services, from crisis intervention, just somebody to talk to people needing more long-term treatment. And I think that we have a lot of work to do to stand up a system that people can find easily, that takes them all the way from giving some basic information about how to manage stress and how to deal with having your kids at home 24 hours a day, all the way through to people who really are going to need more ongoing clinical treatment for both existing mental health issues. People with anxiety disorders reasonably are going to be having a hard time, all the way through to people who have probably been in treatment but have had that treatment disrupted because they aren't able to go in person to the providers that they've gone to in the past, or those providers are no longer available to them because they may be having trouble staying in business. So we're going to see a surge in the need, and I think there's a lot of efforts around the state, from the governor's office on down to local areas, to figure out how to meet that.
Yeah, and that's especially significant because, as we know, there already had been a large increase in behavioral health issues here in California, and there had been this ongoing effort to overcome stigma and have people seek help if they need it. And also there'd been concern about the lack of resources for people who do need it. So that's something that's gonna, to some degree, be exacerbated by what we're seeing in the survey.
Yeah, I do think, I mean, there's no bright spot to this situation, but I do think we have opportunities to mobilize telehealth resources and other virtual means of getting help to people. Luckily, for many people, both providers and patients, mental health services are fairly well suited to being provided virtually. So we need to use all of those options. I think we see a big interest among the whole population, both licensed clinicians, but also peers and just community members, to want to help and to want to reach out. And so I think we can mobilize volunteer efforts at a lot of levels. But we already had a crisis of a lack of sufficient behavioral health workforce, mental health clinicians, from psychiatrists to social workers to addiction counselors. We don't have enough of those people in the system as it is, and we've already had trouble with access. We're going to see, it might look a little different than it has, but we're really going to need to continue to work on those baseline issues of how we staff for this and how we provide access.
All right, a lot of information to chew on. Catherine, we appreciate your sharing the findings with us.
Very happy to be here.
Catherine Teare with the California Healthcare Foundation, thanks so much.
Thank you.